It is great to be with you, John-Arne, who you are the CEO of the Wellcome Trust. I think our audience knows the Wellcome Trust really well. They probably know you for the many hats you've worn in the past at CEPI. You're the founding CEO there. You're the ambassador for global health from your native country, Norway. Are you the first non-UK citizen to be the head of the Wellcome Trust?
I think actually there was one Australian,
Okay.
but some decades ago. So in the recent time, I'm the first non-Brit, a non-native English speaker, as you probably hear. So
it makes sense in the sense that Wellcome has become such a global institution. It's a real pillar of global health.
Yeah, but I think actually Henry Wellcome, when he established the trust back in 1936, almost 90 years ago, he had that global vision. He was a very globally oriented man. He went around the world, collected items and tried to understand culture related to health and was very interested in science. So he definitely had a global outlook when thinking about the value that science can bring in improving health for everyone around the world. Of course, the times were so different. The capabilities were very different.
Right.
But today we have capabilities around the world. They need to improve, and Wellcome can be a part of improving that.
Yeah, what's incredible is the amount of capabilities, how quickly they've grown, and yet the access issues are still there, right? The lack of R&D funding for global South countries, the lack of
absolutely.
access for these innovative medicines, the gaps are still massive.
The gaps are huge, but I'm sort of a half-full glass man in the sense of I think we have achieved so much. Never had lower child mortality, never had longer life expectancy, but still the differences are far too large, and at least one important part of that is lack of or inequitable access to medical technologies, health products, pharmaceuticals, vaccines, and so forth. And the long-term sustainable solution to that is to build capabilities in science, innovation, broader R&D, and also manufacturing in all regions.
Right, to do it in the countries that have these biggest gaps, not just
I'm not saying that all countries should be self-sufficient, because I think the health industry, the commodities, the pharmaceutical industry is and should be a global industry that's efficient. We need that scale because there's so high risk in innovation.
Sure.
But we need distributed capabilities across the world. So it means that all individual countries should not have capabilities necessarily, but they should have it closer to themselves and maybe have parts of a supply chain or a value chain when it comes to science and health products.
We're talking the day after Trump's inauguration. There have been many changes in the global health funding landscape, but it seems like the broad trend is global North countries are pulling back somewhat on their commitments. Not just in the US, all over the world this may happen.
I wouldn't call it pulling back. I think what I would say is that there has been a huge success of global health financing over the last 20-25 years after the new 1,000-year change in 2000. And we have achieved results in global health with very dedicated investments. I mentioned child mortality due to vaccination, malaria treatments. We have reduced incidence of HIV and AIDS, just to mention a couple. And then I think then the challenge after the pandemic, the world has now many other emergent crises, partly due to conflicts and wars. So it's not active withdrawal from the global health financing instruments. It's just the competition for funds have become harder,
right? And
the amount of funds for development aid has become smaller, and that's a political will question. It's a contested territory in many countries, as we know, but I believe, relatively speaking, global health is still a high priority in very many donor countries as well.
What about neglected tropical diseases? When you think about the gaps that exist there, again, in this broader context where global health funding is coming down, there's so many competing priorities. How do you see the opportunity for Global North funders to get more engaged?
Yeah, so neglected tropical diseases have a double gap in some way, because there's still a substantial innovation gap. So we do not have the necessary technologies and the most modern technologies for both treatment and preventions, so vaccines, pharmaceuticals, other health technologies. And then there is an access gap. We are not fully using still the tools that we have in the toolbox. The challenge is that at least many of the neglected tropical diseases fall onto the most vulnerable people in the most vulnerable countries. So it means that it probably still needs almost a humanitarian sort of approach to some of it. That's why I think it is important that pharmaceutical companies still have donation programs and are willing to contribute in that way, and that we all need to see it as a collective responsibility. But there is still, as I said, an innovation gap. There's a need for more R&D and make sure that we do innovate. We at Wellcome have infectious diseases as one of our priorities, and we have decided to prioritize really diseases that are disproportionately affecting vulnerable communities in low-income country settings, and also where there are the biggest gaps in funding. So leishmaniasis, for instance, visceral leishmaniasis, schistosomiasis are examples of diseases that we are prioritizing.
These are some of the best buys in global health in theory, right? If you can reach the last mile, we have very inexpensive interventions. We know how to treat them, but yet the gaps are still there at this point.
Yeah, the gaps are there, but as I said, I think we also need more better, more modern treatments and tools, including vaccines, and because many of these have the ability, or at least we have the opportunity to eliminate disease locally if doing it properly.
And unlike NCDs, where there's more a private sector-led model or domestic funding model, what is the role of global aid, global health aid, when it comes to neglected tropical diseases? Is that a place for them to play a bigger role?
As I said, I think the aid has a special role to play when there are challenges for, in particular, vulnerable groups and societies. So neglected tropical diseases is definitely one of them. We are at Wellcome a science funder, first and foremost. So it means that we are contributing upstream and to the science base. But I hope the global health community overall will have a collective responsibility for that.
So we're soon going to be on stage in a small room with global health pharma CEOs. What is your view about the pharma industry, and what role can private sector, both on the investor side and the pharma side, play in this kind of new paradigm in global health?
Yeah, so pharma is playing a really crucial role, and their products have contributed to the improvement I talked about in child mortality and life expectancy. We need to, I think, understand the pharmaceutical ecosystem as a collective responsibility in a way for all actors. So we need strong partnerships across private sector, philanthropy, and public sector in also making sure that we meet the innovation needs that are not met currently. So that's on the R&D side, and that we have approaches to equitable access that goes across all major disease areas. So that's a responsibility for the CEOs to play a role in that system and to see it as an opportunity, because as we know, the world is changing. Populations, the big populations are in emerging economies.
Right.
That's where the markets is already from a public health point of view, and also from a commercial point of view, will be growing markets.
So in years past at this annual meeting of the World Economic Forum, there's a lot of conversation about global health architecture. Of course, Gavi was launched here. CEPI, which you led, was launched here.
Yes.
Often it was a question of what's the global health architecture and what do we add to it? Now we're in a very different political and funding moment. How do you think about the architecture we have today? Do you think that it's fit for purpose? Would you look to kind of a change in the way things are structured now? What's the role of WHO, which the Trump administration has just said they'll pull out of, or the Africa CDC in this context?
I think so. There is probably now an important point in time for actually do have a holistic look at the global health architecture. The problem with that is to have architecture, you need an architect, and there is no clarity on who's the architect, what's the body, what is the mechanism for actually having a holistic view of the landscape. It is a thousand flowers bloom approach to global health. It's in a way it's a marketplace.
Yeah.
But I think we need to make that marketplace more rational. We need more efficiency in that. We need more effectiveness. We need more coherence. We need more coordination. We need more common approaches to countries. I hope that we will be able to see evolution in that direction, because we need to probably do more with less resources overall in the coming years. The World Health Organization plays a really crucial role in this. It is the normative body when it comes to setting guidelines and setting the main norms for how to do things across countries. It's guidance. It's not put on countries without their sort of own interest. So I think we need still a strong WHO, and we need partnerships on health security. Cross-border health threats, like we saw in the pandemic, do not respect country borders. So we need collaboration across countries. And the US has such an important role to play in that ecosystem, from a science point of view, from a commodities, technologies point of view. And I'm sure the US-based institutions, irrespective of this withdrawal from the World Health Organization, will play an important role in that global health ecosystem.
I appreciate that optimism. I like
we need to be optimistic because we want to achieve more.
I like the can-do approach that you're bringing to this role. You've just been in it a year now. Congratulations on taking it, and thank you for taking a few minutes on the sidelines here in Davos with us.
Thanks for the opportunity.